This trigger film was developed for health services to use as part of an experience-based co-design process, EBCD. EBCD is a patient-centred quality improvement process. The film is intended to get local people, patients, families and NHS staff talking together about how they can jointly improve people's experience of health services. You can find out more about this process and how to use trigger films by accessing this link to the EBCD toolkit. This film draws from a collection of 31 interviews with people caring for someone with dementia. The interviews were conducted across the UK by the Health Experiences Research Group at the University of Oxford. It includes people talking about realising there was something wrong, getting a diagnosis, medication and treatment, and accessing information and support. The full study can be seen at www.healthtalk.org. We'd like to know more about how you used this or other trigger films in the collection, and we'll be grateful if you would spend a few minutes completing our feedback form. The link to this is on this page.
I thought that dementia was something that very elderly people got. I equated it with senile dementia, and that as bits of our bodies age, so of course the brain ages, and I had no idea that it could attack someone in their, well, I think he was 49 when it really started, and now of course I know that it can attack even earlier than that. And so I associated it with somebody probably in their late 70s and 80s. And I think I had a picture of someone sort of quietly losing their marbles in a corner, you know, like grandma's in the corner and she isn't quite with it, you know. I did not know, anywhere near enough.
I became aware that my husband was getting a little bit less quick on making decisions or remembering things. He was older than I, so he was then in his 70s, well, early 70s. And I just thought, oh, he's getting on a bit, you know. But it was clearly more than that after a little while, I realised. And he was also becoming increasingly concerned about his eyesight, having lost the sight of one eye during the war, and the other not very good. Looking back, I now realise this was because he was beginning not to recognise letters, and it was the beginning of him not being able to read signs or the newspaper quickly and things like that. At the time I just thought he was possibly having more problems with his eyes, but it turned out to be the case, but wasn't related to what I now feel was really wrong with him. His speech also became very less clear. He'd always been a very clear and decisive speaker, using the right words and syntax and everything. So there was, he used to stumble for a word, a perfectly normal word, nothing peculiar, and not be able to grasp what had been said to him very quickly. But everything else slowly vanished. Difficult time, but it happens doesn't happen all at once. It's like a light bulb going, actually. You get a flicker and you think, oh, there goes that. And it might go on for some months, the fact that he can sometimes do something and sometimes not. But you know in the end it's going to go, and then one day it's gone. One day you can dress yourself, another day not. One day you know that your socks go on your feet, the other time they could go anywhere.
Impotent fury, I think, would aptly describe the way I felt. I felt quite depressed because I felt so helpless, and I tried to get the help of the doctor, and the doctor did say he would come out and see him, but I thought probably he would refuse to talk to him anyway, even if he came out. So impotence and anger, those were the two main feelings I can remember. Here was he going along with his life as he wanted it, and I was knowing something was going drastically wrong, and yet unable to get him to do anything about it. His short and long-term memory have both gone. His language is very repetitious and very limited. His understanding of what's said to him is very limited too. He'll pick up on a few key words and repeat them, but doesn't really fully take them in, although he can do things. But sometimes you have to ask him or tell him 3 or 4 times before he does them.
Did actually having the diagnosis help?
In some ways it did. It was, I suppose it really just made me accept that what I'd feared as the worst was actually the worst. That there was no doubt anymore. It was dementia, and it was a progressive situation. And although it was upsetting, it was calming in a way, because you couldn't kid yourself any longer. Not that I had kidded myself all the way along, but not that I really knew what was involved with dementia at the time. But yes, I suppose in some ways it was a calming but upsetting situation.
I left the doctor to talk to my mum in the living room and went into the kitchen and sat in the kitchen listening to her answering the questions to the mini mental test score, and I think that was the first time I realised quite how wrong things were, because listening to her trying to answer those questions, it's a good test. Some bits of it were completely normal, and you could see the different areas of cognition and memory that it was testing, and some were fine, and then there were others like short-term memory and language skills and things, which my mum, as an ex-teacher and very interested in English and history and literature, had always really prided herself on her control of language and use of language. And listening to that from the other room, I just realised that she was really quite handicapped already. So at that stage the doctor had made a diagnosis of borderline dementia, but trying to explain that to my mum was very difficult. She obviously wanted to know why this doctor was coming into her house and talking to her and asking her all these silly questions, and sort of at that stage the doctor did say, "I feel there's something wrong with your memory," and she completely denied that and got very upset, and that's another reason I think to be with people when they're seeing the doctor, even in a home setting where they've got a home visit, because one thing I found over several appointments with different professionals is that after they've gone, you're often left to sort of pick up the pieces of somebody who's very upset, and it takes a while to do that. It's not the fault of the person who's come to do an interview or talk to the patient, it's just that the realisation that people are looking at somebody's mental state. When a doctor comes and takes blood or examines you or looks at your physical state, then that's an affirmation that there's something physically wrong with you, and our society is clearly happy with the idea of labelling somebody as being physically ill. But there's still an enormous stigma, especially with people who are older in our society, about the idea of mental illness.
I think it then took about 6 months working through the GP before we finally got an appointment at the memory clinic, and the diagnosis was given, and that's just 2 years ago. I think the interesting thing about that day was the way in which the diagnosis was communicated to us. I had imagined that I would be called in separately and would be told covertly what the problem was, but in fact what the consultant did was to call us both in and simply tell us, without wrapping it up at all, that we had dementia. That actually quite shocked me. It caused, of course, enormous initial distress, but I think looking back it was one of the best things that ever happened, because it made us both face the reality in a sort of honest and open way. And I remember within 24 hours of that, sitting in this room and saying, well, I'm not going to let it get me down, I'm going to go on living my life as best I can and getting what help I can. And that's meant that since that time we've been able to talk about it openly. We use the term dementia or Alzheimer's quite openly. She knows why we go to various meetings. She understands why she's at the day centre. She knows that the people who come to the house have come because she's ill with a particular complaint. And I think that's been enormously helpful to us. And I do feel very sorry for those people who for various reasons aren't able to be open with the person that has dementia.
If I could send all professionals along to the former psychiatrist that I had, I think they would get it right. She was the first one who saw me, was the psychiatrist. She came here to see him because he wouldn't go to the doctor. She was kind, she was concerned, she was informative. She told me what was going on and what needed doing. She didn't talk down to us at all. She never made you feel that you were wasting her time. I got the diagnosis from her a few weeks later. Again, she was extremely kind, very concerned, didn't try to blind me with science, just gave me the facts, which I wrote down because I knew I wouldn't remember them. Said what they'd done and what they'd found, and then was very sympathetic and just talked to me generally. And that's how it should be. I think the professionals need to understand that for every patient they've got, it's a tragedy. It's a terrible tragedy to the people who are caring for that patient. And every single person, every single case, be it one of 20 in that day, is the same for the people who are caring. They need to feel that the consultant is focusing on them for a start off. They're not just another statistic. They are just another statistic, but they're a human being as well. And if you can impart information, answer questions in a kind, considerate, sensitive manner that makes the carer or the patient feel that they are being focused upon rather than just trying to get rid of you, then that would help.
And certainly on several occasions when my wife was being asked questions which the person answering wouldn't know whether they were right or wrong, but I, being there and knowing it was my wife, knowing they were wrong, I found that they were pretty reluctant to actually talk to me. And on several occasions I had to say, that is not the situation between my wife and I. For example, they were asking my wife if she had sex. She said yes, regularly. I knew full well that we hadn't had any sex for a number of years. I knew it was the wrong answer. But the person asking the questions wouldn't know whether it was a right or wrong answer. That's only one example of the type of questions that were being asked that I knew full well through sitting there that my wife was giving an incorrect answer, which again the person asking the questions wouldn't have had a clue whether it was the right or wrong answer. So I think that, and indeed I did make one recommendation to one consultant that we saw, that it might not be a bad idea to have a set of questions for the carer, if they're a close carer, not necessarily the same questions that they were asking the person that they were asking the questions of, but asking if they had experienced any behavioural changes.
The consensus seemed to be that certainly had got these failings, but they did not, or were not prepared to prescribe anything like this until it was, in their mind, confirmed that she had in fact got Alzheimer's. So reluctantly I had to agree with this. Now it took about 9 months and several visits from them when they tested and then said, well, we'll retest you after a while to see whether there has been any deterioration on her various abilities. And finally, sitting here, Dr. said to me, well, yes, the answer is Alzheimer's. And we would recommend that we put the wife on 5 milligrams of Aricept a day, and then for a while and see how that goes, and then we'll test again, and if necessary put the dose up to 10 milligrams a day, and test again, and all the rest of it. And that is the situation that we're in at the moment. I was, well, you cannot be annoyed with doctors, and they're the bosses after all, and they should know what they're doing, but I did feel that waiting something like 9 months with the deterioration being perceptibly worse, and knowing that had it been prescribed 9 months earlier, it might well have arrested it at a much more less serious condition.
If you can deal with the behaviour without the medication, and you have got experienced expert carers and nurses who are able to deal with it without the medication, obviously that's better. But there comes a point at which they do need medication, and my mother is on medication, and I think it's right that she is on medication. I then think that what doesn't always happen is the medication is not monitored enough. And I think, as was in my mother's case, and I'm sure is the case with a lot of other people in a lot of homes, the medication was used more than was necessary for the convenience of staff, because it keeps people docile and it keeps them sleeping in a chair. And I realised my mother needed medication because she was distressed all the time and anxious and worried, and so she needed something just to take that edge off. And when I saw her sleeping, I'm very confused, and I thought, how much of this is Alzheimer's and how much is the medication? So I actually went to see her doctor, and I was so lucky. She's got this lovely young girl, seems a young girl, she's probably in her 30s, doctor, who is really nice and very thorough and very keen that we work together. I hope I'm not a threat, because we are nice to each other. And I actually made an appointment at the surgery and went to say that I just want your advice, that I'm not sure. I just wondered, I don't know about these things, but I'm wondering if my mother is very heavily sedated, and whether there was any mileage in whether they could lift the sedation, and if that made her too agitated, whether there was some sort of antidepressant, because I know antidepressants can work in a different way. They make you easier about life. And she said, oh, I see what you're seeing. She said, I don't actually know, but I'll phone the psychogeriatric specialist and have a chat. And the message came back, he thought it was worth a try. And so that's what they've tried, and they've lessened the tranquilizers, given an antidepressant as well. And it may change tomorrow, gradually it may change, but at the moment, my mother's got back a better quality of life. I don't think it would have happened to my mother if I hadn't been there. Actually, I think she'd have a better quality of life. So I think if it's at all possible, you don't use medication at all. And obviously the professionals know better than I when medication should be brought in, but I think there's a danger of it being used unwisely, indiscriminately, if you like.
I used to go into hospital for 2 weeks respite care every 3 months or so. And I took in a man who could walk a couple of miles around the village, no problem, every day. And I went to collect a man who was in a wheelchair, who couldn't stand, who was zonked out. And for the first time ever, I challenged medical authority. And that is so difficult to do. Because I've always assumed up to that point that medics knew what they were about, that they had introduced so many drugs that he was completely and utterly zonked out and couldn't even stand. He was able to go to the loo, but they put him in incontinence pads. And so I asked that he be taken off every drug that had been introduced in that fortnight. He had to stay longer in the hospital until he was fit to come home. And what had happened, of course, is that they'd found his behaviour rather difficult to handle, and so they had run to the medicine bottle. And I think over-medication as a form of restraint is a national scandal. And we carers should not be afraid to make waves when it happens. But the interesting thing to me was, at the point of diagnosis and at the next appointment at the hospital, it was confirmed that this was the most likely scenario. We were kind of just dropped into thin air. When I compare what a cancer sufferer might have and their family at the point of diagnosis, where for us was the backup of either a specialist nurse or a telephone number to ring, or I didn't even know the existence of what was then the Alzheimer's Disease Society at that point. And I certainly had no idea where a local branch might be. And I think we were all in such shock. We needed people to come to us to help us, rather than ourselves having to go out in the highways and the byways to find help. And I think that's happening to a lot of carers and a lot of patients, that they are, at the point of diagnosis, just turned off into the street, dropped into thin air. We went back to the hospital many, many times over the following 2 years, and for umpteen psychometric tests. I was given scores, and his results were conveyed to me by letter. But actually what I wanted and what I wasn't getting were strategies for everyday living. And it was how to help him to celebrate what he could do rather than to get depressed with what he couldn't do.
Unit where he goes, it's just wonderful there. The whole setup is very, I don't know the right word really, they're all batty, but in a professional way. They can be quite sort of uninhibited in joining and sharing, but they manage. I mean, watching who's the manager there, she is just so good with him. And she can get him to go to the toilet and get him to wash himself. I can't get him to wash his hands after the toilet, but she can. And the whole atmosphere there is lovely. I mean, I've been in and out times unannounced, and the atmosphere there is always good. They're very respectful to the clients, but they can have a lot of fun with them. And it's just, I'm just so lucky, I think, to have it.
There are still conflicts there, and I have to think to myself, well, you've just got to get on with it, basically. And the woman at the home is very good. She said, look, if you have a day or an evening and you think, I just can't take it anymore, bring him in, leave him overnight. She said, it's as open as that. Just bring him in. You've had enough. You think, I can't cope with this. She said, you don't have to phone us, just bring him in and leave him for the night. And knowing that makes all the difference.
I think the position of the long-distance carer, which my sister and I had, is particularly not recognised. I don't think anybody realised that we didn't know the system, because everybody thinks the system in their own area is the obvious one. And again, as I mentioned in that handout about carers' meetings, they're not the slightest bit of good during the week. I did try to say to the Carers Association here, let's try and have a meeting at weekends, but I don't think it got very far. I certainly think, that they need to recognise more that carers are there trying to help. They're part of the partnership. They need to be kept informed. Well, the social worker only appeared to work from 9 to 5 Monday to Friday, and she used to have long holidays. And we didn't know what to do when she was on holiday. I presume if there'd been an absolute problem, we could have phoned up. But there was no sort of out of hours service. And again, I felt that really, you know, coming back to this matter of her neighbours ought to have been furnished with the number of somebody they could have phoned in the evening rather than us. But we weren't given the number. And it's all very fine expecting people to know how social services work. You don't. And I understand that there is an emergency number which the police know, which again comes back to the situation of the police taking responsibility. We weren't given the number. And we sometimes also phone up the social worker and she wasn't there. And we were never quite sure that messages got through and so on and so forth. So it was really very, very unsatisfactory. You know, not seeing the family as an enemy, trying to see the family as part of the solution, keeping them informed, valuing them, supporting them, as I said, realising that there are things they need to know. I mean, it would have helped enormously if, for example, we'd been sent the names of any carers organisations in. If we'd been told if we'd been sent a list of all the day centres, if we'd been told of any local services, I feel that there should be a carers pack, that once somebody's diagnosed, the family should be given a pack or perhaps put on the internet or something like that. And since, even in these last few years, I've begun to realise that there's a lot of organisations that could have helped us, but we didn't know how to find them.
I think it's the lack of information. I mean, real information, not just hearsay, that's quite hard at times. I didn't know what the disease entailed. I didn't know I did know there was no cure. I did know at that time there was no treatment. I didn't know there was any care, respite care available until it was far too late. Even if it had been suitable, it perhaps might have been earlier, I don't know, before the real fear and terror set in. It's this generalisation, and probably not true of many of them, but some of them, ones that I've met, assume that there are various services for this and various services for that. I didn't know I could get a thing to go over the loo so that I could sit properly without falling off. I didn't know I could have little handles on the door. I didn't know I could have got a wheelchair. I didn't even know there was a community psychiatrist. I don't know why I didn't know that. I suppose it never occurred to me to ask. But certainly nobody told me. I don't know whose job it would have been to tell me. I don't sort of suddenly think, oh, they should have told me. I don't believe this mysterious they one has to take responsibility, but it would have been nice to know from somewhere that there was somebody I could have spoken to. Perhaps a little earlier. And 2 days before he says, okay, he's got to go in. But maybe that's what they do, I don't know. Those I did meet were perfectly nice and helpful when I finally got to meet them. So I would say make yourselves known. Or make public your availability. Bearing in mind that carers don't go out very often, they're stuck. Maybe, but I don't know how they could do that.
On the whole, I found the carers and caring service, because they were got by the DSS, but they were private firms. So all they're looking to do is make a profit, and it showed. It showed in the fact that some of the girls that came just didn't care. So and really that would put me on thorns, because when they came again, I wasn't in a position really to say too much at that time, so I just let it go. But it bugged me quite often. I mean, all I was concerned about was what they did, not whether they dining or stuff like that. But apparently they do have set routines, but which proved to me that some of them were just sitting and not caring, which which wasn't very pleasant. And out of all of them, there were only 2 who ever took her out. All the rest didn't take her out at all, even for a walk around. So as far as that side of things were concerned, I weren't very happy at all.
During all the time I wasn't here, the help that I wanted was company and for things for him to do. And all they would offer me was washing and ironing and cooking and cleaning. And I could do that. I'm the generation that isn't overwhelmed by domestic things. I went to work. I didn't particularly want to do them. I paid a cleaner, but I don't mind doing them, and I didn't mind. But I wanted him to have company. I wanted him to have stimulus, and that could never be provided in any way. And he didn't fit. He wouldn't cooperate, and there doesn't seem to be a way around that either, to cope with the awkward and the stroppy. And if you've been awkward and stroppy all your life, you're entitled to be awkward and stroppy when you're dementing.
I think I got most of my information from talking to other people. You see, I've been going to carers now for 5 years in July. I've talked to an awful lot of carers. There aren't many of us, there's probably 6 of us at a time. But I suppose that's when I picked up what I call practical information about different people's reactions, different people's problems, which has been far more helpful. And also, when my wife was here, I never got much time to read. By the time I was ready to read of an evening, I was nodding off at any rate.
I think as a carer you want to feel that there is a professional who is there almost at any time for you to draw on their support. I think they have to be good listeners. I think they have to not come along with a premeditated idea of how things should be done. And I think listening to carers and to patients is very, very important indeed. A good example of that would be our consultant, who I think, although quite an eminent man, is extremely good at listening and thinks very hard about what you say to him, and I appreciate that very much indeed. I think there's a balance, isn't there, between, on the one hand, not being dominant as a professional in giving advice or taking a lead, but on the other hand, not being afraid when they think it's absolutely necessary to take decisive action or to recommend a strong course of action. It's a fine line between the two, but I think that's a skill and an attribute that they need. And I guess someone also who likes people of all sorts and different kinds, and I think that shines through in some professionals, and I think communicates itself certainly to the patients. You know, here's someone who genuinely likes my company and is not just doing it for a professional reason. So those are some of the things that strikes me that you need in professionals.